Tooth loss has long been treated with artificial solutions like crowns, bridges, and dentures. But recent advances in regenerative medicine have sparked public interest and sometimes confusion about whether we are truly close to the possibility of naturally regrowing human teeth. Scientific research into tooth regeneration is showing promising developments, yet it remains an emerging field with no approved, commercially available treatments as of now. This video will look at the current state of tooth regrowth research, examine who is working on it, explore the materials and methods involved, and address some questions about its availability. Just a reminder to hit the like button and subscribe if you enjoyed this video. It's completely free and helps the channel. Thank you, and let's get started. To date, there are no approved or commercially available treatments that allow people to regrow lost adult teeth. One of the most advanced efforts in this field comes from Regrow Biopharma, a Japanese company working on an experimental antibody drug. This drug is designed to inhibit the USAG1 protein, a natural suppressor of tooth development in the body. By targeting this protein, the treatment seeks to reactivate latent stem cells and initiate the formation of new teeth. Regrow's preclinical and early clinical trials have generated attention because they offer a potential method for regrowing real, functioning human teeth without relying on synthetic implants or prosthetics. Still, this research is ongoing, and the treatment has not been approved for use outside of controlled trials. Until then, any claims of full tooth regeneration offered commercially should be met with a healthy degree of skepticism. While Regrow Biopharma is currently the most visible company working directly on stimulating whole tooth regrowth in humans, it is not the only player in the space. Several companies and research institutions worldwide are involved in broader dental regeneration efforts. Major names such as Dentsply Sirona, Straumann Group, 3M, Zimmer Biomet, BioHorizons, and Integra Life Sciences are exploring advanced dental biomaterials, tissue engineering, and scaffold technologies. These companies typically focus on improving current dental solutions rather than pursuing full biological regeneration. Their innovations include materials and tools that assist in repairing or rebuilding parts of teeth, gums, or bone, which are often used in conjunction with dental implants and restorative procedures. Although they are not directly regrowing teeth from scratch, the technologies developed by these companies contribute essential building blocks to the field and may eventually complement biological therapies like the one being developed by Regrow. Despite the exciting research underway, tooth regeneration remains unavailable to the general public. The most advanced therapies are still several years away from approval. Regrow's team estimates that, if trials continue to show positive results, their antibody-based treatment could reach the market around 2030. That means, for now, patients needing tooth replacement must rely on conventional treatments such as dental implants, which have improved greatly in terms of effectiveness, appearance, and comfort. These traditional methods can restore function and aesthetics, but do not recreate the natural biology of a lost tooth. The science behind tooth regeneration involves a mix of biological strategies and material science. Regrow's approach uses an antibody to interfere with USAG1, a protein that limits the growth of new teeth. By blocking this inhibitor, the drug could trigger the body's stem cells to restart the process of tooth formation, essentially mimicking how our baby and adult teeth first developed. This kind of biological solution would represent a major shift in dentistry, turning it from a field that replaces damaged structures into one that stimulates the body to heal and rebuild itself. Alongside biological treatments, other researchers are using synthetic materials and scaffolds to support dental tissue regeneration. These methods typically focus on repairing parts of the tooth, gums, or jawbone. Common materials include hydroxyapatite, a calcium-based mineral that mimics the composition of natural bone and enamel. Chitosan, a biodegradable polymer made from shellfish that can be shaped into scaffolds. Glass ionomer cements, which chemically bond to tooth surfaces and release fluoride. The enamel matrix derivatives, or EMD, are protein compounds that stimulate gum tissue regeneration and are often used in periodontal treatments. While these materials are valuable in clinical settings, they are not capable of regenerating an entire missing tooth. Instead, they are best understood as tools for rebuilding damaged areas or supporting implanted structures. At this stage, there is no established cost for tooth regrowth therapy because it is not available on the market. However, if and when such treatments become approved and offered to patients, they are expected to be expensive, at least initially. The cost will likely reflect the years of research and clinical development required to bring the treatment to market, as well as the novelty and complexity of the procedure. Over time, as the technology matures and becomes more widely adopted, prices may decrease, especially if insurance companies begin to cover the treatment. For now, dental patients must continue budgeting for traditional treatments like implants or bridges, which vary widely in cost depending on materials, location, and individual dental needs. In summary, the possibility of regrowing teeth in humans is no longer just a fantasy. It is grounded in real scientific research and clinical trials. Regrow Biopharma is leading the effort to bring a tooth regrowth therapy to market, using an innovative antibody that could stimulate natural tooth formation by turning off a key protein inhibitor. Other companies are also working on related technologies, though their focus tends to be on scaffolds, implants, and tissue engineering rather than whole tooth regeneration. While there is a growing body of promising research, these therapies remain experimental, and the general public will need to wait several more years before they become accessible. Until then, dental implants and restorations continue to be the best available solutions for missing teeth. Before you go, check out some of my other videos. Don't forget to hit that like button and subscribe. Thanks for watching. We'll see you at the next one.